Everyone, I'm Rachel. I'm one of the community managers with March for Science. You may have seen me post from time to time about vaccines and masking and all that good public health stuff. Building trust for the COVID vaccines is a huge community effort, and we're so happy to be starting our own campaign to teach all of you how to be great science communicators in your own networks. Apart from one's own doctor, the best people to raise vaccine confidence come from within one's own community. Our Let's Get Vaccinated campaign is all about teaching you, the vaccine boosters, how to be a dependable and effective point person for each of your friends, family, and colleagues, so that if they have any concerns about the vaccines, you can help them through their fears. Public health measures don't work unless there's public buy-in, and now more than ever, we need public buy-in so that we can transition to a COVID-free world. With that, I'd like to bring on Rania, our Interim Executive Director of March for Science.
Thank you so much, Rachel. Hello and welcome to our March for Science family joining us tonight or today, wherever you are. It's my pleasure to be joined by three incredible humans for the launch of our Let's Get Vaccinated series. So please virtually help me welcome virologist at Georgetown Center for Global Health Science and Security, Dr. Angela Rasmussen, actress and activist, and just all around amazing woman, Alyssa Milano, and internal medicine physician and public health activist and national leadership team member of one of our newest partners. We're so excited about this from This Is Our Shot, Dr. Hussain Lalani. Thank you so much for joining us and for being here. As I said earlier, I know there's so much going on. So the fact that y'all are taking some time to be with us for the launch of this series is very, very exciting. But we want to just dive right into the work, right into the conversation. All three of you bring incredibly important perspectives through your work and your advocacy and your activism. And we're just going to dive right in. And I'm going to start with you, Dr. Rasmussen. Angie, the Biden administration, thankfully, believes in science. It's sad that we have to put that so high up there, but it's true after everything we've gone through the last handful of years. But the Biden administration believes in science, and we're seeing some improvements on as far as hospitalization numbers and testing goes, but death rates are still high. We're battling nearly a full year of misinformation. So Angie, I'm going to start with you. Can you clear up some of the confusion and help us set the record straight? What is this whole conversation around double masking? Should we be worried about these variants that we've heard about, 3 that have been discussed and in the media that folks have probably heard about? And after folks get vaccinated, should they still be masking and practicing those public health recommendations that we've been hearing about?
Those are all great questions, Rania, and thank you so much for having me here to answer them. I'm going to start with the variants, actually, and then I'll talk about some of the things we can do about it. So we should be concerned about these variants, but that said, we also shouldn't freak out about them. So what we do know about these 3 variants, which have really unfortunate names, B117, B1351, and P1 from Brazil, is that they're more transmissible. But we don't actually know the mechanism. We don't know how they're more transmissible. So it could be a number of different things. It could be that people are shedding more virus. It could be that people are able to be infected with a smaller dose of virus. It could be that people are remaining contagious for a longer period of time. It could also mean that the viruses are more stable in the environment. It could mean all of the above. But what it doesn't mean is that the variants have acquired new capabilities. They can't go through masks. They can't be transmitted in new and frightening ways. We can basically, the good news is that we can basically prevent ourselves from getting them. We can reduce our own exposure risk by taking the same precautions that we can take for all of the other SARS coronavirus 2 variants that are circulating. And now to get to your question about masks, double masking is certainly good, but you can also, instead of double masking, you can just use a mask that has multiple layers. You can use a mask that has filters. You can use a KN95 mask so long as it fits your face snugly, and so there's not a lot of space in between. The important thing is that you wear a mask, but masks are not the only thing that you should be implementing in your daily life as well. You should also be practicing distancing. You should avoid gatherings in enclosed spaces. You should avoid crowds. You should stay home if possible. And I realize that's not always possible. But if you implement as many of these different measures, you should also wash your hands and disinfect high touch surfaces. If you implement as many of those as possible, though, you're going to be as safe as possible because risk reduction is additive. And then, of course, once the vaccine becomes available to you, you should get the vaccine. I know a lot of people have been very concerned about these variants possibly being able to evade the protection that the vaccines induce. And that is true to a certain degree based on some clinical trial data that we've seen from South Africa. But that data is actually not that bad. What that data shows is that the vaccines still protect people against those variants. They also protect people from having really severe disease and from dying from COVID, which is really one of the most important measures. So continue implementing all of these exposure risk reduction methods in your daily life. Implement as many as possible, get a vaccine when you can, and hang in there because we're only doing this for another few months if everybody sticks to this plan. I think that, we should be concerned, but we also should be hopeful because the end is in sight. If it's not right in front of us, it's just a few months away.
Thank you so much, Angie. I know that makes me feel better just hearing from you. And you're really in the thick of the work. So thank you. Thank you. I'm going to pop on over to Alyssa, and I'm going to just preface this by saying we really at March for Science, y'all have heard me say this a million times. You don't have to be a scientist or a physician to make a difference. I'm not a scientist, nor am I a physician. I always wish I was. I'm not. It's okay. I'll get over it one day. But March for Science really does exist to bring us all together. Everyone can do something. Everyone is good at something. And Alyssa, you are sort of the epitome of doing what you're good at and really getting out there strong, utilizing your platform in all the ways possible. So you, to what our subject matter is for today, you worked really hard and came out strong and publicly to push global leaders to equitably distribute the vaccine. And I know we're still in the midst of scaling up production and distribution and all of these kinds of things. But why was it so important for you to lend your voice and your platforms, again, to encourage other influencers and leaders to do the same when it comes to equity and justice in the distribution of the COVID vaccine? And can you also talk a little bit about what that means? What is equitable and just distribution?
Yes, absolutely. Well, first of all, I had this virus back in March, and I've never been so sick in my life, and it affected and impacted every part of my being. And there's still days like last night. I was lying in bed, and I still have, a lot of the long hauler symptoms. So I really know what a toll this takes on the human body. And so, being someone that experienced that, but also someone who I'm a UNICEF ambassador. I have been since 2003. I understand that in the battle of this terrible, terrible, terrible disease, we have to remember that no one anywhere is safe from COVID-19 unless everyone everywhere is safe. And we've had a lot of scientific breakthroughs towards not only vaccinations, but also treatments. And that is so crucial. But from my perspective, and as someone who looks at this as a global health issue, that is really just the tip of the iceberg. It's the first part of the equation. And equally as important is making sure that every single person on this planet can get the vaccine as soon as possible. President-elect Biden, I would like for him to make the COVID-19 vaccine a people's vaccine, a global public good. Basically, we've paid for it. with our taxpayer dollars, billions of dollars. And from my perspective, we have to start prioritizing the most in need, not only here at home, but around the world. And this is a case of the people who are rich enough to get, or the countries that are rich enough to get this first batch of vaccinations are the ones that are getting it. And it wouldn't be outside of or it wouldn't be an exaggeration to say even hoarding it. More than half of the vaccines developed by these companies, with the 5 leading vaccine either candidates or the ones that we have seen already approved, only 4% of the world's population is getting that first batch. And the US has already called dibs on almost 50% of Pfizer's total expected supply next year. So in my opinion, these major corporations like Pfizer and Moderna and anyone else working on this vaccine really have to share the vaccine technology so that we can enable, billions of doses to actually be made as soon as possible, and at the lowest price, so that everyone, everywhere, can be protected. This virus does not know boundaries. It will travel, and until we get everyone vaccinated, we're not safe. And again, we've already committed to $10 billion in public money towards this vaccine. So that is our taxpayer dollars, right? I mean, it's not just corporate research and development budgets. This is money that we're contributing. And most vaccines are largely funded by public funds, which is something that not a lot of people know. So they must, in my opinion, be a public good for public safety and public health. So I am fighting real hard for patent-free, mass-produced, distributed fairly, and made available free of charge to every individual, rich and poor alike. And that's where I am, and I hope people will join the fight. I'm calling it the people's vaccine.
I think thank you so much for all you've done. And again, you don't have to use your platform this way. And in fact, a lot of people don't. So much appreciation for that. And I think you bring up such an important point. I mean, this is like the issue of humanity, right? We are all, in fact, in this together, one way or another. And like Angie said, we're not gonna be safe till we're all safe, right? So you bring up such important points, and
and a vaccine shouldn't be auctioned off to the highest bidder.
Yeah, absolutely. That's not what we're talking about here. You're so right. Thank you so much, Alyssa.
Of course.
And Dr. Lalani, Hussain, I am going to jump over to you. As I mentioned, you're on the national leadership team of This Is Our Shot, which is a campaign that's really helping to elevate the voices of healthcare heroes to build vaccine trust digitally and virtually, like I mentioned, we're so excited to partner with y'all. Can you just tell us a little bit more about the campaign and the organization, and also just touch on why medical doctors are among the most important messengers when it comes to vaccination trust in science?
Absolutely. Thank you so much for the invitation. We are thrilled at This Is Our Shot to work hand in hand with March for Science. So at This Is Our Shot, we're a national grassroots coalition of over 25,000 diverse healthcare heroes. That's doctors, that's nurses, that's medical students, and healthcare workers. And we represent over 25 national organizations. We're all coming together to build vaccine trust on social media and to combat misinformation with the goal of achieving a COVID-free world for all of us. And science, as we've talked about, has achieved this tremendous feat. And we've successfully produced at least 2 highly effective and very safe vaccines that will protect us from COVID-19. Yet, as you mentioned, we live in an age where misinformation and disinformation are rampant across our society, and it threatens the integrity of facts and science. And this is all in the midst of structural racism and immense suffering that's felt by many people, particularly members of communities of color. As a primary care doctor here in Dallas, I have the honor of caring for patients who are underserved and come from largely low-income, predominantly Black and Hispanic communities. I hear their voices in clinic, in the hospital, every single day. And many of them are worried, and they have legitimate questions about this vaccine, and they should be heard. And the good news is that the vast majority of them trust their personal doctor, and not just any doctor, but they trust their personal doctor to provide them with accurate information about the vaccine. And they want to know what their doctor thinks. And we've heard countless stories from my colleagues, from members in our coalition about their experiences and how patients are really interested in what their doctor thinks. And the data bears this out as well, that doctors are more trusted on the COVID vaccine than any elected official, than any local public health leader. In fact, they're even more trusted than Dr. Fauci. And recent polling has shown that when it comes to trusted messengers, doctors are among the top. And it's not a political issue. It's regardless of your political party, regardless of your race, people trust their personal doctor. So we think that it's critically important for all healthcare heroes to be involved and united in this effort to build vaccine trust for a COVID-free world. And we'd love for you to join us if you're listening out there. Join our Facebook group, our Instagram, our Twitter page, and share your story about getting the vaccine, who you hope will get the vaccine soon. And let's work together and let's build trust and defeat this virus and end this pandemic.
Thank you so much. The first time you and I spoke, one of the things we talked about was the importance of having an honest conversation too about that distrust, especially in Black and Brown communities. And I know that's something y'all are really focused on, and you have been such a champion and ambassador for. Is why is that the case? It's valid, and like you said, I see you, I hear you, has to be the mantra, has to be real and at the core of it. So thank you so much for just taking the reins and running full force to really help our communities. This it's massively important, and thanks. The whole campaign y'all are running is really phenomenal. We're so excited to be partnered with you. And I am not going to let everyone go quite yet. We're almost there, but one more question for all 3 of you as we wrap up today. I just would love for you to give us your final thoughts on what you hope to see in the coming days and weeks and months. What are your biggest worries, but also what are you optimistic about? And Hussain, I'm going to start with you.
Yeah, absolutely. I think I'm concerned about the disinformation, and this targeted approach that's being followed by, multiple campaigns to really target our communities of color, to sow distrust, causing anxiety and fear about the vaccine, and really trying to debunk science. But I'm hopeful, and I'm hopeful because we've seen over the last few weeks and months that trust in the vaccine is gradually increasing. People say that as they see others get the vaccine, they themselves feel more comfortable and more likely to get the vaccine. And this is something that's also been bared out in recent polling done from a wide range of Americans. And I think that there's something to be said for that. We can all come together, and I'm really excited about this possibility of us uniting as one. This is our shot. This is our shot to get our kids back to school. This is our shot to go back to concerts, to enjoy movies. And this is our shot to be there with our communities, our families, to hug our parents, And I think if we come together, we all do our individual part, like you mentioned early on, have these open conversations, listen to people, let them share what it is that's really concerning them, direct them to quality information, to science that can help, but science that they're able to understand, that's digestible, and refer them to their personal doctor if they have one, or to others who they trust in their community. And let's have an open conversation about this, because this is our shot for our entire community, for our world. And so I'm really hopeful, and I can't wait to be part of this with all three of you. And it's a pleasure to be here with Alyssa and Angie as well.
Thank you so much. Angie?
Yeah, so I'm going to say that what I'm worried about, both Hussain and Alyssa discussed, and that is two-pronged. It is disinformation and it is vaccine equity. As Alyssa said, we are not safe. None of us are safe until all of us are safe. And that really does mean vaccinating the entire world. That's going to be more than a few months away. That's going to be potentially a years-long effort. And I've been very concerned with the fact that throughout this pandemic, not just in the US, certainly the past year and the past administration has really nationalized our response. When a pandemic is by definition a global crisis, it really shouldn't be nationalized. I'm also concerned with equity within our own communities, as Hussain was discussing. Many of the people who are most at risk of getting COVID are not getting the same access to vaccines right now, including in major cities, as people who are not at as high of risk, frankly, people who look like me. So I think that is a huge concern. And also the disinformation actually makes these disparities worse. It hinders our ability to distribute vaccines equitably by decreasing trust, by leveraging things like Alyssa was discussing, the nationalization of pharmaceuticals, the corporatization of vaccine production. All of these things make people suspicious. And if people aren't being talked to in a frank, transparent manner, then that creates a space for that disinformation to thrive. And it's really a vicious cycle. But what I'm hopeful about, apart from the afternoon sun that is right in my eyes right now, and I'm trying to get out of it, I'm hopeful, like that ray of light shining in my face, because of exactly what Hussain and Alyssa were talking about too. We have people, my colleagues, like Hussain, who are seeing patients on the ground in the communities. We have people like Alyssa, who are using their platforms to advocate for equity and justice. That is going to bring people's attention to this issue. My husband is now standing in the ray of sun. That is going to create awareness of this issue. And I think that's half the battle. If we do what Hussain was suggesting and we listen to people, we hear what their concerns are, we meet them where they are, that's going to allow us to all move forward in a unified way. So having conversations like this gives me hope, and really the science does too. I mean, we have multiple vaccines now that have exceeded expectations in terms of their safety and efficacy profiles. We have the ingredients to make this work for all of us globally. We just need to actually get there. And conversations like this really give me hope that we are well on our way.
Thank you so much, Angie. That's spot on. Appreciate it. Alyssa, I'm going to end with you.
So I think the thing that worries me the most, because we have, obviously the science for those that are seeking it out. But I think the thing that we're not talking about that is really, really important is the mental health aspect of what people on the front lines have been faced with, and what our younger generations and the fear that people are living through right now during a global pandemic. And it's something that is getting lost in this discussion. And it is a collective trauma. And I think that it is important to say that it is such. And we got to make sure that people, especially those that have been fighting on the front lines for a year, by the way, so it's repeating the trauma, really have the support and the help that they need to heal from this, and that we can also look at, what this experience has done for everyone, and the fear that we've all felt. I know that there is nothing that gets my anxiety more riled up at night when I'm in bed than the fear of one of my parents going through the sickness that I went through. And that it takes a toll. And I know that I'm not alone in that. So that is my worry, is that we're overlooking a mental health aspect of this, as we're dealing with, the physical ailment aspect and the acute illness. And my hope is that we will come out of this as a nation with a better understanding of how, well, a few things actually. One of which, how it's okay to slow down. It's okay to not have a million appointments in the day. It's okay to be just with your family and appreciate those moments. But also, my other hope is that people will now have a better understanding of how very, very important it is that we make healthcare affordable and accessible to every single person in this country, regardless of employment, not tied to employment, but to really give people the opportunity to be healthy. And what that means is getting them the tools that they need. And a big part of that is healthcare.
I just feel like I
Amen.
need to take a big exhale after that. And thank you so much for calling out the mental health aspect, because, oh my gosh, I mean, and thank you to Angie and Hussain for being on the front lines and living this every single day, and then showing up here with us. Thank you so much. Alyssa, thank you for like I said, for just shouting that out. It's so important. And it's something that absolutely should be centered as we move forward. I could stay here all night with the three of you, but I'm not going to make you do that. Thank you so much, Hussain, Angie, and Alyssa, for joining us for this first episode of Let's Get Vaccinated. Thank you for all you're doing and your perspectives, and we will be together soon, I have no doubt.
I can't wait.
Me too.
Thanks.
Thank you so much, Rania.
Thank you, everyone.
This is our shot.
And thank you, Alyssa and Hussain.
Thank you, Angela. Bye, everyone.
Woo, that was so fantastic. Really, really great first conversation with many more to come. Rachel is joining us again, and we're just gonna kind of wrap up this conversation with a few things. Hello again, Rachel. Thank you.
Hey there. That was fantastic.
Yes, absolutely. And it was just so interesting. So I'm going to share a little personal story real quick. I got my second vaccine. I don't even remember what day it is, but a couple days ago. And it really, it was about 12 hours later, it just knocked me on my ass. I'm just going to say it. All the flu-like symptoms, the sweaty and then cold and achy and exhausted and all the things. And I'm much better today, as I hope you can tell. Brain is a little foggy, but I'm doing much better today. And I have to tell you, I would do it 1,000 times again. I really would, just for all the reasons that have been discussed, and really, getting the vaccine as soon as humanly possible is I think should be a priority for all of us. But yeah, and that's one of the things that Dr. Lalani and I had talked about before too, is just being honest about, the truth about vaccines. Sometimes there are side effects, and that's normal with any vaccine. And so to pretend like, oh no problem, no big deal, nothing's going to happen, well, that's not helpful either. So we're hoping to have those kinds of conversations as we move forward as well.
Yeah, and I've had really similar conversations. I was actually supposed to get my second dose yesterday, but it was postponed until Sunday because of the snow. But a really good friend of mine is a nursing school student, and she got her second dose of Pfizer a couple of weeks ago, maybe 2 weeks ago, and she was texting me about how awful she felt and said, this is the worst I've felt really ever. I cannot imagine how COVID sickness feels. And as cruddy as I feel now, I would do it again in a heartbeat if that means that I won't have this for 2 weeks or longer.
Or more, right? Exactly. So yeah, we're just really in that light, in that vein, as we try to open up these lines of communication and just have very honest, frank, transparent conversations. March for Science is so proud to introduce our new vaccine campaign, #VaccineBoosters. So clever. And it's a new initiative that's part of our broader campaign to educate the public about the science behind COVID vaccines and to talk about the injustices and inequities that contribute to vaccine hesitancy in a lot of ways.
As part of this work, we're training thousands of volunteers from around the country to be vaccine ambassadors in their communities. Apart from one's own medical provider, the best people to raise vaccine confidence comes from within your own community.
Absolutely. So for example, folks out there probably have friends who have asked if you're getting the COVID vaccine and expressed concern over getting it. I'm going to just be really honest. I had some hesitancy myself about this vaccine in particular, just because of things that had happened in the previous administration and some of the capitulation that happened with some government organizations that should not have happened. But after having some conversations with experts who I'm close to or in my community, I felt much more comfortable about it. And so the goal of this campaign is to help just arm all of us with information and show that we all have a role to play to talk to people and communicate and have conversations about the vaccine that are actually productive, not confrontational, and as was mentioned during the interview, I think it was Angie who said, like, meeting people where they are. It's so important.
Yeah, I'm going to add another story, little anecdote to that. So I'm about as heavily vaccinated as they come. My whole family is so pro-vaccine. But for similar reasons to you, my own mother was a bit hesitant about this one. And it took until a doctor local to my town actually put out an email to the town's local working moms page that explained, this is why I'm getting the vaccine and this is why you should also get the vaccine. And I mean, I tried with my mother as much as I could. I'm her daughter. I'm this big vaccine advocate, but it really took a practicing physician to say, I'm getting this vaccine and you should too, before my mom felt totally comfortable with it. And she is getting her second dose tomorrow, I think, actually. So it worked out well.
Yeah.
So we're in this campaign, we're working with top experts in public health, vaccine hesitancy, health disparities, and science communication to develop workshops and trainings that are based in solid research. We want to teach you the do's and don'ts of online debates, how to tell the good information from the bad, how to organize in your communities, and how to help our most vulnerable members book appointments for vaccines. But we also want to teach you how to have a productive conversation with your communities.
Absolutely. As I mentioned before, it really is going to take all of us to tackle the misinformation and the disinformation and ensure that there is equitable distribution and accessibility to the COVID vaccine. And if you're interested in joining us, our amazing Chief of Staff, Izzy, is going to drop a link into the comment section where you can sign up to be a vaccine booster. We're very excited about this and we hope you're going to join us.
And finally, we'd like to thank our March for Science community for the donations that make these programs possible. If you believe in this campaign, please consider making a donation so that we have the resources to maximize your impact. You can donate. I think Izzy will also post the link below. And I wanted to make one more plug for our newest outlet, which is a YouTube channel, which I think Izzy will also drop the link to. And we would really appreciate if you would subscribe and share it to all of your own networks.
Absolutely. Thank you so much again, everybody out there in our March for Science community, for joining us today, and we will see you very soon.
Bye.